Good day. Welcome to Public Health Ideas. My name is Sandro Galea, and I serve as Dean of the Washington University School of Public Health. Today, I have the privilege of speaking with Cal Halvorsen. Dr. Halvorsen is an associate professor at the Brown School and a secondary faculty member at the School of Public Health and a senior fellow at the Harvey Friedman Center for Aging. He's also a faculty affiliate at the Karolinska Institute in Sweden. Welcome, Carl.
Thank you.
We're going to discuss population aging and how we can shape better health outcomes for older populations. So, Cal, let me start by asking about your research background. Tell us a little bit about the path that led you to where you are today and what you study.
Yeah. So basically, I look at how can we keep older adults active and engaged in their communities. That's the simple way to say it. And I'm really inspired by my own family. Growing up, after my grandfather retired, he was a professor of dentistry. That's when he founded a new business called the Tubacist to help young kids actually hold these giant tubas between their legs while they were practicing. And then he took up gardening and painting. And my other grandpa, when he retired, started to work for my dad in his business. And I worked with my grandpa all summers at my dad's shop. And things like that. And my parents to this day are in their 70s and they're still working part-time. And this gives them a sense of purpose and meaning. And so I've kind of linked that with my I've noticed that just throughout my life, I've hung out with older people and I've always enjoyed it. I talk to them just like everyone else. And I've noticed that not everybody does that. And so that kind of led me during my Master's of Social Work program. I came actually to the Brown School almost 20 years ago with the idea that I would be working with kids in the child welfare system. Just through my own family's experience, I've lived with probably over 30 children who are in foster care, and that's what brought me to social work. But while I was here, I realized that my joy in working with older people is not that common among a lot of people in their early 20s. And it's something that I could tap into. And so, mentorship was really helpful in getting me to move into gerontology, working with Nancy Morrow-Howell, who's at the Brown School. And then from there, I just continued with this through my career after my MSW, working at encore.org in DC. And to this day, it's a lot of fun. There's a lot of gerontologists who focus on long-term care, dementia, caregiving issues, things like that, all super important. But I find the most joy in working with people in their 50s, 60s, 70s, and 80s who are wanting to live in their communities for as long as possible, who want to work or volunteer for as long as possible.
That's a great story. I did not know about your grandparents. Lead us through the next 50 years. What's it going to look like in terms of the aging global population? Give us some numbers, trends, capture the trajectory.
We're going to get older throughout the world. So to give you some ideas, 2019 in the United States was the first year on record we've ever had more people over the age of 62 than under the age of 18. And the reason we chose the age of 62 when running this analysis, and this was using current population survey data, is because 62 is the first year that you become eligible to take early Social Security retirement benefits. And so now we're at about 11,000 people turning 65 each and every day in the United States until about the year 2030. At the same time, we have fewer young people. In some regions of this country, we still have growing numbers of children, but in some regions like New England, they're expected to have a basically flatlining number of 18-year-olds through at least 2030, which is causing problems at liberal arts institutions, for example. Some of them are closing because they don't have enough young people coming in there. Now, when you look globally, the world is aging. So the famous countries for this would be Japan, South Korea, China, Germany, France. They're even older per capita than we are here in the United States. But even in places that we've thought of as very young, oftentimes because of poverty and access to healthcare, the HIV epidemic, for example, in certain countries in Africa, the treatments are working. The people who are at the very lowest levels of poverty, there's fewer of them now. People are living longer. And so as a result, you even have countries, places like Nigeria, for example, that by 2100, they're expected to have way more older people, people over the age of 65 than they do today. So no matter which country you look at, by 2050, by 2100, we will have many older people. And as a result, a lot of countries, both places higher income like the United States, Europe, Japan, et cetera, they need to think about how do they rework their pension systems. But a lot of lower income countries now are having to think about how to start pension systems.
Sometimes I feel like when we talk about these numbers, it feels abstract.
Yeah.
paint a picture. So like, what does 2100 look like from a demographic point of view in terms of how does that change the day-to-day fabric of who people are meeting?
So right now we know that, well, not only are people living longer, but people are having fewer children. If trends persist and immigration remains low, immigrants tend to be younger as well. What this means is that as a share of our population, we're just going to have way more older people. And just on a daily basis, kind of like what you're asking, when you're just walking down the streets in your community, you will see fewer children. That can feel like a shock. Like when I was in Stockholm over the summer, I actually noticed more children. So that was surprising to me because this is the first time in my life I went somewhere else and I thought, wow, there's more children here. And that surprised me. So yeah, looking at 2050, 2100, if everything continues as we're thinking, we're just going to see a lot more older people. Now, the question is, how healthy are those older people going to be? And if we can find ways to keep them active and engaged, of course, keep working on advances in healthcare, then we'll find people living in their communities for as long as possible. The dream is that's what we do. The opposite of the dream, I'm forgetting the word, but that would be where we find more people in long-term care facilities, which is not what anyone wants.
So tell me a little bit about, let's talk about health now. So what path are we on in terms of health trajectories for older people as the world ages?
We are on a trajectory where we have more and more older adults who have chronic conditions, chronic diseases. This could be hypertension, diabetes, arthritis, vision problems, things like that. We're also seeing growing rates of cancer. This is also happening in younger people too, by the way. So those are some of the kind of the negative or the scary sounding things. The positive thing is we are seeing much more advances in these as well. Even cancer treatment rates have gotten better. So people are living longer. Now, it can kind of scare people because when you look at the data, you see a lot of people over the age of 65, 70, they have multiple chronic conditions. And we want to try to avoid this because if you have too many of these, it gets harder to work longer, it gets harder to stay engaged with your families and your communities, and just to get outside of the house. And so that is something that we need to prevent. Now, in my area of research, since I'm not in the medical sciences side of this at all, but also we want to think about how can workplaces, how can organizations do a better job of engaging people and through paid work, through volunteering. What are the policies to make it easier for people to do that? In the workplace, for example, are there phased retirement initiatives at organizations so people don't have to choose between working 40 hours a week or working 0? We know it's good for you, for example, if you slowly phase out. It's good for the organization. For many organizational dynamics purposes, you don't lose the knowledge that a person has built up over their career, but it's good for the individual as well. They have a higher sense of purpose and meaning, and it's better for their health in the long term, because retirement going from 40 hours a week to 0 for many people is not good for you, and we know this through data.
So you've captured some parts of my next question. So let's talk a little bit about our, let's call it complex way of dealing with aging.
Yeah.
Right. So in some respects, we know we have an aging population. That's not really a surprise to anybody. We're about to have 2 presidents back to back who are over 80.
Yeah.
Much of the political class is over the age of 65. So people who are older are well represented in leadership in society. At the same time, we have a very youth-oriented culture. At the same time, we have not been investing in some obvious things to create for friendlier cities for populations who are aging, for some of the policies that you're talking about. So why is that? Like, lead us through that. Like, you think if our political class is mostly older, we would be more further ahead in terms of policies that advance the cause of healthy aging, but we're not. So what's going on?
Well, that's a tough question, but I would say, one, I like how you kind of described it as like the complexities. It's not, oftentimes when I see it described in news articles, for example, I've seen the term generational warfare. And on the ground, I really don't see that. A lot of the work I've done with organizations on intergenerational issues, you have older people and you have younger people who care about the same issues. And so with that said, in Congress, does feel a little bit weird when the median age of the Senate and the House is so much higher than the median age in this country, which right now is around 39 years old. Whereas the median age in the House is 58, the median age in the Senate is 65. So this is a major difference. And now part of this is built in. So in Congress, you have to be at least 25 to enter the House. You have to be at least 30 to enter the Senate. But with that said, I understand why people are upset. And even me as a gerontologist, and I'm actively trying to combat age bias, age discrimination, it's a little weird for me too to see our highest elected officials being so much older on average than the rest of the population. I do think that that could cause some issues because they are so far removed oftentimes from the daily lived experiences of young people that they might be forgetting some of the important issues that people need, that people are worried about today. So I am concerned about that. But what I can tell you is a lot of the work that is going on the ground, people are working together across generations for the social good. I've run national surveys in collaboration with Cogenerate, a national nonprofit, and NORC at the University of Chicago. And people want to work together across generational lines for the social good, which includes public health issues. Some of the top issues that people, regardless of age, care about are mental health, are the environment, educational reform, things like that. And so people across the age spectrum actually care. Now, how do we get that moving into Congress and politics? I'm still struggling to figure out how to do that.
Leaving aside the mechanics, if we had the proverbial magic wand, what are your top 3 policies that we should be implementing, let's say nationally for a second, to promote healthier aging?
One would be, we don't have a national long-term care policy. It is incredibly expensive for people as they get older, and if they need pretty intensive care to receive it, to the point where a lot of people basically are forced to go into poverty through what's called a spend down in Medicaid. And there's a lot of people who are terrified of this because they end up not having any money left besides about $2,000 in their accounts. And there's no money to leave their children if they were hoping to do so. The good news is there are some states that are really innovative in this space. They are starting to create these, in a sense, long-term care insurance programs on a state-by-state basis where workers who live in that state can start to pay into the system with the promise that when they get older and if they need long-term care, they can enjoy that benefit. Another thing would be, we really need to tackle Social Security retirement benefit reform. 1983 was the last time there was any major change to Social Security law in terms of just the benefits that people receive, the income. And this is directly linked to health because we know that people living in poverty in later life, many people do. Many people are living solely off of Social Security. And this is not good for you. It's hard to afford their medications, hard to do a lot of the things that they need to be well. And so we really need to look at how do we fix Social Security moving forward so we actually have it. Because if we do nothing in 10 years, the trust fund will be depleted. And that's not going to be good for older adults in 10 years and older adults in the future, like me. And then the third thing is actually organizational policy. So oftentimes when we think about big policies to help with aging societies, we're thinking about at the federal level or even the state level. But something that I think is really important is at the organizational level, and I think this indirectly relates to health, is how are organizations doing a better job at keeping their older workers and honoring their older workers. I've looked at, and I've conducted surveys before where we've found that workers later in their careers, for example, in their 50s, don't feel they're getting the same professional development opportunities as people in their 20s, 30s, and 40s. They're not being promoted to the same extent. The thinking behind this, because I've also talked with managers, is, oh, well, these people aren't going to be here for as long. That's actually not true. You see a lot of job turn among people in their 20s and 30s and 40s, and people in their 50s, they could be at your organization for 10, 20 more years. And so it's really good to invest in them. So why does this relate to policy? At the organizational level, they really need to do a good job in HR departments, for example, of ensuring that people, regardless of their age, are getting professional development opportunities. They have the same access to promotion opportunities, things like that. They have the ability to have phased retirements when they want, but not to be pushed into it, because this is good for our population health overall. If we can keep people working for as long as possible, as long as they choose to, I'm not talking about any forced longer working lives here, then that means they have continued income, continued purpose, continued meaning, that we know that this is good for them in the long term. If they start to feel pushed out, feeling a sense of age bias or discrimination at the workplace, that is not good for them long term. So, I gave a couple examples of federal policies, but I do think organizational policy here is exceptionally important.
Yeah, that's actually interesting. Let's talk about technology for a second. So in general, in full disclosure, I tend to be skeptical that often we think of technology as a panacea, and I think often it's not. But nonetheless, let's push it. So what technology do you see that is realistic and actually useful, is going to be useful in dealing with healthy aging?
Yeah. So, one for fun, I was going to talk about wearables because I've started to wear a wearable lately, and that's fun to track. But I don't know how many people are going to want to do this long term and what the long-term impact is. What I will say this, and I don't, that's not my area of expertise, but I will say technology overall has dramatically increased access to information. And I think this is really important for older people, to get access to healthcare information that could be useful to them, to stream public hearings that relate to health issues that they can, type in their questions via Zoom for a public hearing, things like that. Because we have this stereotype of older people not using technology, but that's not really that true. If you look at the Pew Research Center, they track this over time. Older adults are using technology not as much as young people, but it is rapidly climbing to the point where the vast majority of older adults have smartphones, they know how to use computers, things like that. So that's one answer to your question. The other answer to your question is within organizations, we need to do a better job, and perhaps this involves some public policy too, to ensure that our workforce is continuously trained on the newest technologies. It might not look obvious at first why this relates to public health, but given my prior answer, if we keep older workers as trained on these new technologies, new software systems as younger people, they're going to be able to keep their jobs for longer. We know that people in their 50s, if they become unemployed, it's much harder for them. It takes a lot longer to find new jobs than people in their 20s and 30s, for example. This is not good for their individual health. And so if we can keep people as trained as possible in the newest things, they can keep their jobs for longer. If they lose their jobs, they'll get the jobs faster. This is better for their health.
Let's build on that. Let's talk about purpose and meaning.
Yeah.
So we know that purpose and meaning are associated with better health on multiple dimensions. What are our responsibilities as a society, and how do we actually actualize those responsibilities to create opportunities for purpose and meaning for people as they get older?
Yeah. One of the things I would say is a shared experience that a lot of people have, but few people kind of talk about on a societal level, is retirement. There are millions of people who are retiring. And if you go from working full-time to not at all, you have a great likelihood of losing your sense of purpose and meaning. And so there are things that we can do to counteract this. One is working with people as they're moving into retirement, as they're planning for retirement. What do you want to do next? Many people, by the way, don't want to do anything. Totally fine if that's their choice. But a lot of people over time will feel this sense of loss. It could be a loss of connections, social networks from the workplace. It could be a loss of feeling like you have a purpose or a reason to get up in the day. And so are there programs and policies that can help them to do that? One example would be AmeriCorps. AmeriCorps we think of as being for younger people, but AmeriCorps programs are also open oftentimes to older people. There's even something called AmeriCorps Senior, which is strictly designed for people 55 and older. So how can we grow these programs to be more of a cultural norm for people, where after you retire, maybe you take a couple years and you join AmeriCorps. Perhaps you move to a different location, or perhaps you stay where you're at. So that's just one example. But also thinking about your question related to purpose and meaning is, you're right, we know this is good for you, but it's good for you in a variety of ways. We know it's good for subjective measures of health, for example, depressive symptoms, self-reported health. But we're also now finding that purpose and meaning is actually really good for your biological health. We're finding that people with higher senses of purpose actually are experiencing decelerated epigenetic aging. And so that links into some of my research on volunteering. And volunteering can feel like an aw shucks kind of nice thing to do. And I've had people respond to some of my research this way. where it feels like a really cute area of research, but tell me what really matters here. And what I would argue is that this does matter. When we have so many people who are out of the workforce, it is important to find ways to keep them engaged in our communities. Now, you can have what's called formal volunteering, at least that's what we call it in the literature, where it's you're volunteering for a nonprofit organization that could include your church or place of worship, where you're helping them to meet their mission. It could also include what we call informal helping, just helping friends and neighbors in need, or joining a little community organization to help with organizational cleanups or community cleanups. All of these things we know are actually good for you on the things that are easy to measure. What I think we need to work better on as researchers, but this is really hard, is how do we look at kind of the collective benefits of engaging more people in our communities throughout the lifespan, so older people, but also people at mid-career and younger people. How do we measure the impact of everyone working together toward a shared purpose of improving their communities? That's what I think we're struggling to look at right now, but I think it's incredibly important.
So I think that dovetails nicely into my penultimate question. Talk to us about multi-generational solutions. I know you do work on that. So what do you mean by multi-generational approach? And how does it actually lead to healthier populations, both for younger people and for older people?
Yeah. So this arm of research for me, most of that work I do with two nonprofit organizations. I work with an organization called CoGenerate, and they're based out of San Francisco. They're a nonprofit advocacy organization running programs nationally, trying to make it easier for people across the lifespan to work together for the social good. The other organization I work with is called Treehouse Foundation. They're based out of Massachusetts, and they create these intentionally intergenerational communities where you have older adults living in the same community as families that usually have children who are in foster care or have been adopted. So it creates this nice ecosystem of support for everyone in that community. And I would say it's incredibly important to do this because even from our national surveys we ran, where we found that if we think about the environment, people regardless of their generation really cared about the environment and would like to work toward improving the environment, working on climate change, things like that. And yet, when you look at the organizations that are actually doing this work, some of the most famous ones are geared toward youth. And it gives you the impression that only young people care about the environment. But from our research, we know that people who are much older also care about the environment. So how do we find ways to bring people from all walks of life, all ages, together to work on these social issues? My concern is sometimes that when we create nonprofits or grassroots organizations on specific issues, we might only get people involved in those specific organizations who we know and are like us. And so that could include people from our own age groups. And so, it's hard to measure, but how do we get people from throughout the lifespan together to work on these issues? I think that's a really important question. But organizations like CoGenerate, in my opinion, are doing a really good job of this. I've been advising on a project with them where they're interviewing leaders of nonprofit organizations, who some of the leaders are young leaders, some of the leaders are older leaders, and they're asking them, how can we do this intergenerational co-leadership so we can get the experience from the older adults and their ideas, and the experience and the ideas from the younger people, and how can they co-lead these initiatives moving forward? Right now, they're at the more qualitative stage of the research, but it's really rich, nuanced information, and they're coming out with some reports on that. And moving forward, I think it'll be great to also get some quantitative data to supplement that.
Last question. Let's end on a positive note. So what gives you hope in this area in this moment?
As a social work researcher who does a lot of work in public health, I actually have a lot of hope right now. It's easy on the day-to-day basis to lose hope when you look at certain news events, but I get a ton of hope when I work with my students and I just see how much they're learning, how much they care, the jobs that they have gone over. My career as a professor only began in 2018, and just to see the work that some of my former students are doing is amazing. And then I also look at just key indicators of public health over time, and that helps to remind me that we really are improving over time. And I think that's a good kind of a reset for me when I find that I'm feeling a little bit less optimistic.
So I'm in my 50s.
Yeah.
And I noticed throughout our discussion, older people are 50s, 60s, 70s, 80s.
Yeah.
So it's good. It helps me orient where I am in my life. But also, I appreciate you didn't use the word old. You only talk about older people.
Older. Yeah.
Which I appreciate. I've been trying to tell my kids to think that way.
Yeah. Yeah.
So thank you for a really interesting conversation, Cal. And
Thank you.
Thank you for everything you're doing. And thank you, everybody, for joining us.